Are you feeling back pain along with the burning sensation that is traveling down from the back to the buttock region into the thighs and legs? Or are you feeling any tingling, numbness, burning sensation or cramping in the leg or foot? Or do you experience any weakness in the foot which causes the foot to slap while walking? Then the reason of all your symptoms could be spinal stenosis. Hi, my name is Ishan Arora from PriMovers.com. In this video, we are going to discuss about one of the back pain conditions that we get to see as we grow older. Unlike many other back pain conditions, spinal stenosis is caused by the narrowing of the space of the spinal canal, which is the house for the spinal nerves as they descend from the back into the legs and thigh. This happens as a result of the degenerative process happening in the spine, also known as arthritis of the spine. In order to treat spinal stenosis, it's important to understand the condition properly. So let's dive in right now and understand what spinal stenosis is.
Lumbar spinal stenosis is one of the most common back pain conditions as we grow older. American Academy of Orthopedic Surgeons estimated the amount of spinal stenosis can affect around 8 to 11% of the population. Who all are at the risk of getting the spinal stenosis? The spinal stenosis can happen to anyone, and it's more common in men and women above the age of 50 years, as in that age the process of degeneration in the spine starts to set in, which results in wear and tear of this part of the spine and the hypertrophy of the supporting structures, which result in compromised space for the spinal cord and the nerve to pass through in the spinal canal. Another most common risk factor for spinal stenosis is the spinal fracture or the tumor. The part of the fracture or the tumor can get into the spinal canal and reduce the space for the spinal cord and the nerve to pass through, resulting in the pain symptoms traveling from the back to the buttock region to the back thigh and into the leg as well. The third most common risk factor for spinal stenosis is the abnormal sideways curve of the spine, also known as spinal stenosis. Because of the abnormal sideways curve of the spine, there can be reduced space for the spinal cord in the spinal canal and can result in increased pain symptoms in the leg. In spinal stenosis, we tend to see increase in symptoms when we stand and walk. The reason for that is reduced space for the spinal cord and the nerves in the spinal canal in these two positions. As we stand and walk, that causes the natural spine extension, which results in reduced space for the spinal cord and the nerve in the spinal canal. Versus in positions like bending forward, as in case of prayer position, or standing forward bending position or sitting position, results in increased space for the spinal cord in the spinal canal and the nerves, resulting in decrease in symptoms from the back and in the back of the thigh and the buttock region and into the leg as well. There are various studies that have been done on spinal stenosis. A review of the randomized controlled trials done by Jared Slater and others in the year 2016 mentions that while there are many options available for the treatment of lumbar spinal stenosis, but customized spinal position correction exercise is considered to be the first line of treatment, as it is associated with reduced complication and cost as compared to more invasive treatment options. Another study done by Wiener et al. Reported that flexion-based movement of the spine, which is like the forward bend position of the spine, has shown to increase the walking time and distance before the onset of pain symptoms in patients with lumbar spinal stenosis. Flexibility of the front hip muscles, also known as hip flexors, and strengthening of the lower abdominal muscle may also lead to better position of the pelvis, low back complex, and decrease the pressure on the spine structures in case of lumbar spinal stenosis.
I hope you have understood what spinal stenosis is, and if you have any questions related to spinal stenosis or back pain in general, don't forget to leave it in the comment box below. Thank you for watching my video.